Proud to see you.
So when we started talking, Professor Agnes, it's such a pleasure to actually have a conversation with you today. When we started talking about like what is the role of technology in health, we actually went more onto the bigger picture, as in what is the role of technology to really boost social capital and economic growth? And just like, I'd like to start by saying, I think that we're the first session today that is not talking about real technology. So maybe this is a way to have a reality check and see how technology can really help improve and change lives in countries like yours, Rwanda, and mine, Mexico. So can we actually just like have your sense, being the former Minister of Health of Rwanda, having more than 93% of the kids in Rwanda being vaccinated. Actually, that's more than in the US or any other country.
Of course.
No, but that was well done. 93% of all kids in Rwanda getting vaccinated.
Now, so, she doesn't say everything. Vaccinate against 11 antigen for boys, 12 for girls. Fully. The best on earth.
There you go. So what is the role of technology in actually boosting, you know, like what's the role of technology in boosting social capital? And then we can dig into your health, nutrition, stunting, obesity, and what can technology do to help?
So the first thing to remember is you can work for technology. First of all, you work for human beings, isn't it? You work for the people to have something better. Here it's health. And you cannot manage, for me, you cannot manage the health sector without technology. If not, you don't know how to deal with this immense and huge amount of data that you have to collect to manage the health sector. So this is the role of technology. It helps you to manage. It helps you to understand what is your setting, what is changing. When you have a new emergence of a disease, it helps you to control outbreak. Remember Ebola, SARS, and all those things that are coming we don't know. And it helps you to manage the vaccination, meaning you know, you have the list of kids, you know the percentage that are vaccinated, you know those who are not vaccinated. You can go and ask why. And if it's because of supply chain management, you have a software to manage it. If it's because you don't have enough sensitize that area, you can use social media to sensitize. You can use ICT, internet. You can use Facebook, and you can use also Twitter.
But you were actually fearless. I remember when I was working at the Global Fund to fight AIDS, tuberculosis, and malaria, you were fearless about like fighting for developing countries in the view of donor countries to say, you know what, really what we really need is food and shelter and the basics. Why are you asking for money for technology? And it took you actually a couple of years to get ICT systems going. But tell us about that journey. Tell us about what ICT, how can actually a country like Rwanda can really grow and you know, like be ready for the bigger picture, or how can it fall behind if you don't invest in technology? What was your journey?
So the journey is to be opportunistic, meaning you have Global Fund, you have WHO, you have USAID, you have CDC, who want to give money for HIV because it was, okay. So we say, okay, give the money, but to manage HIV, we need ICT. We need technology. And you take that technology and you apply to the whole health sector. And to manage it, you create an equity platform for your country. You say that what we need is every Rwandan, whatever place he lives, to have access to IRVs. To have this access, you need to have access to testing. To have also the IRVs, the little sector where he's living needs a pharmacy that it's well, that without stock out. So for all this, you create a connectivity. You create the capacity to all and each health center to report based on ICT, so that I don't have to read all those reports. Can you imagine? We have 3 community health workers in 50,000 villages. That means 45,000 reports every month. The one who pretends reading them is a liar. However, if they report with a phone, and everything go in a way I don't know because I'm a pediatrician, in a way it go to a server, and I just have somebody very clever who just interrogate the server for me. Where are they vaccinated? Where there is a problem, and it allows you to reach the last miles where there is a problem and to focus to the vulnerable, not to those who have no problem.
And I have to give her credit. At this time, it's impossible for all of you probably to believe here how much paper is actually, like done or it was done in countries like Rwanda or Mexico or others, because health workers go from village to village. They capture the data on paper. They go to the data. Well, they go with this stack of paper to the hospital. The hospital actually has to digitalize it. By the time you actually get to digitalize it, the patient probably is gone. So
or dead.
That's what I meant. Yeah. In a way, what we're saying is, yeah, bye-bye. But altogether, what I'm trying to say is that now that you realize how well, like how much you have connected Rwanda, is there a business opportunity? Or is this like going to meet now? Is Rwanda ready for more business opportunity on the health sector so that technology can come and say, like, now that you have a country that is connected, now that you have understanding of your data, you probably have more communication along your standards and your data in Rwanda than probably other countries here. How many systems do you think that the U.S. has, and are they connected really when it comes to your health care? So does your insurance connect to your doctor, to connect to your dentist, and so on? Probably you don't have that, like socialization that you have done in Rwanda. So is there what's the business opportunity now that, like in health and technology in Rwanda now?
So if you, of course, there is always something new that is more friendly to use and that can replace what we have. So it has to bring something to the sector. It has to bring more ASEAN-friendly to use and time that we save. But first of all, it needs to be interoperable, what you don't have here. Here, it's chaos. I will not like to be your minister. Because, no, sincerely, because I don't know how to talk to all those software that doesn't talk to each other and that make the life of people more difficult. You are so clever, you have so much brain. Make it interoperable so that doctors can work with you easily. There is a lot of opportunities out there. And Rwanda is a model of ICT. Each corner is connected. And to tell you, there is no woman who dies around pregnancy or delivery that we don't have immediately the age, the place, the name, and the why. And to reach that level is the only way we can save every woman. And we have reached the MDG thanks to that. We have an instant notice at ministerial level for each woman who dies. And this we can have thanks to the work you do. You do an amazing work. Talk to each other.
And on the talking to each other, on the systems of talking to each other, you have also on nutrition. And nutrition means stunting, or in this country, for example, obesity. 1 in every 4 American kid is either obese, or actually 1 in every 4 goes to school hungry. You have dealt with, how can technology help that problem in this country?
So
if the systems are, like not as coordinated as we know, and basically,
but you
like
need, first of all, to coordinate. But there is something that the world believes we do because we are poor. We are poor, that's true. We are not a rich country. But we have community health workers in each village. You have so many young people or middle-aged people that are jobless. Imagine that but it has to be an enterprise who do that. But you have community health workers in each 200 households in this country. You give them a very good tablet with all the nutrition standards. They took the measurement of all kids. They find this one is malnourished because too much, this one is malnourished because not enough. They put the data in that tablet, and the tablet gives what to say to that family.
Is that artificial intelligence?
That is artificial intelligence. Will never replace human intelligence. Will complement human intelligence. Meaning you need to teach the human to use that intelligence to expand their own capacity. And that's what you are doing here.
But also, you and I discussed that ICT even, artificial intelligence and technology cannot work without political will and policy.
That's it.
And altogether, you can have as much advancement and goodwill, and even a business opportunity in countries like yours, or in countries like this. But altogether, if you don't have the willingness to, put the policy in place, it's going to never be able to be complemented or put into action.
Yeah.
So in a country where, you have now set up the Global Health Equity University that basically tries to train people to invest equitably. That means going to the last first, the poorest before, going to every corner, to the rural areas where no one, when you think that there's no one that will be forgotten according to this equitable investment. But in health, in this country, for example, how do you do with a policy that is actually trying to cut budgets for welfare or social care, actually leaving those that are left behind even more behind? What do you do with how do you actually overcome policies that are going to be restrictive in budgetary investments for the poorest?
You go to your senator and you discuss with him for him to advocate in Congress.
But is there any role that technology can play in there?
The other thing is people like you to come together and set an ICT agenda for the country. You can do that. The third thing is politically it doesn't work. Civil society is still there. And to have a great dialogue, go out of your office and your lab and discuss with the people you want to serve. You can, I just want to recall what the people have done in Guinea and Liberia with the Ebola crisis. Government was overcome, they had to organize themselves. They came and they created security around. Imagine if they had ICT to do it. So that means people like you can go in dialogue to do the software or to adapt the software you have to the needs of those people who try to survive and to live. And let me tell you, it's a win-win situation. You'll make money, they will survive. And so the dialogue with the people who have the business and the technology with the community directly when the government doesn't work well, or with government when the government works well. It's an investment, but you can come in a country like mine and see how much we have invested. It was a big thing in the beginning, and how many we are winning now. Mm-hmm. It's enormous.
So a lot of progress made. I do want to open it up for questions and answers. I mean, there are brilliant people in the audience, Esther Dyson. I would love, I would love to open it up. But let me ask you one question. So we are now getting to understand what it means to rule with tweets, and have presidents and governments actually have a tweet diplomacy that is quite proliferous and, yet understandable. But I have to say, I think that you started that trend.
Yeah.
A number of years ago, you were bashing everyone that I remember in the planet with your tweets. And I think that you have, no, literally, if you don't know, go back. This is probably 10 years ago where she was actually doing diplomacy on your face with her tweets. And so she was saying, I don't like what UNICEF is negotiating with me right now. Boom. And we were I think we have to talk. But, so you started with this.
And suddenly they love to talk.
No, but literally, you did that.
Yeah.
You did, did you actually have to pay any political price for being so, open about your, your opinions on Twitter?
No, I got so much return. First of all, I build trust with my people because they can also tweet me. And my commitment is to answer any tweet before sleeping. And so when they see that, I tell what you have done as policy is detrimental for my people. Please change for this. First of all, my people are happy, and they start to consider because they are all following me now, and they don't want to look bad. And I can make you looking very bad on Twitter. It's not difficult, and it's fun.
So So here's the question. So knowing that you have you're a fighter, and you have been always a fighter, now you're fighting for equity, meaning to give everyone and every child and every person a chance to have healthcare access to healthcare. So knowing that there are like some governments and some presidents that are actually going to try to cut budgets that allow you to go to those, what would you tweet to certain presidents of certain countries like this one?
Should I tweet the president or you? Who have put, no, that's the reason. The democracy is go with responsibility. Head of state doesn't go there by their own, isn't it? So I will tweet you to be more careful if you are not happy. So that's what I will do, because I'm not going to vote on your place. But the most important for me is to fight for equity, but also to educate the next generation of people who will do that. Meaning to give them the tool, the skills, the academic knowledge, and the academic sense of excellence to do what they have to do when they will be in position.
Well done. I thought you were going to say, like, don't cut foreign aid to my country, particularly if you care about migration. So let's open it up for questions and to Professor Agnes.
Somebody there.
Yes.
Hi, Alka Mansakani from NYU Medical and Health Equity Initiative. I had a question about your idea about health equity. Do you see that as just access to healthcare, or do you see all the other social determinants of health being included in terms of education and poverty and
housing and
all
everything.
of that?
Yes. So that's what we teach, because a doctor, a nurse, a dentist, whatever, if they don't take care about the social determinant of health, they are doing nothing. They are just come, they massage you, you are better, and they send you back in your mess.
And that comes actually to a higher price. Yes. Yes, please.
Great discussion, and if you want to run for president, you have my vote. But a question would be, what you've had some very provocative points about our mindset and our own behaviors as citizens and as people in the healthcare system. But what have you seen as technology that has been implemented in Rwanda that you think could be re-engineered to work in a more modern healthcare system like ours, where we should be borrowing from technology that you're using there?
Thank you.
So I'm a pediatrician, so I cannot go into details. However, we didn't invent alone what we are using. So let's say it's a reversed innovation for you to use the technology you invent in a better way. And this is what we want to teach in our university. How can you use the tool? Because the tool is neutral. The tool is doing nothing. What is important is what you do with that tool. How can you use the tool better to better serve the people and to better serve the most vulnerable? That is something that is forgotten. It is the fact that if you invest in the most vulnerable, you left nobody out and you serve all. And the return, you get what you need. You are there, guy, to make money. Money is a good thing. We do great things with money. But you'll make more money if you invest in the vulnerable and have everybody served. So it's another way to do business with the great tool you invent.
And actually it pays off. And David, if I may, I wanted to, UNICEF will have, the problem we have in investing in equity is that you don't know whether there is a return on investment and whether it pays off or it's just like going to the black hole. But UNICEF is actually going to be launching in June a business case about like how we're narrowing the gaps on health thanks to actually investing in equity. So investing in the poorest, investing in clinics that are far away, investing in actually distribution centers pays off, and actually pays off at the policy level and the prevention level, and actually just like on the not having.
And it pays off like that.
So what we want to do, if you allow us, is actually for us to send that to you to distribute to whomever is interested.
And to add on this, you need to accept to invest in rural area. The majority of the world live in a rural area. And don't believe that because they are totally poor, they cannot contribute a little bit.
Right.
Second, they all drink a beer. Just do a campaign, a beer a month for me. Huh? So, and they will do a traditional beer. They don't have to, but there is always something to invest with the quantity of people. The return will be far more than to serve a minority and have a country that is in bad health condition.
Esther.
Can you just talk a little bit about the actual ecosystem of who's connected, how much is over cell phone, what's the actual experience of an individual Rwandan in their village connecting into this system?
Yeah, so we have the health sector managed by around 13 software. The basic one is the SISCOM, the Community Information Health System. 45,000 Rwandan in 15,000 villages, 3 community health workers, 2 women, 1 man, have a phone to alert us, outbreak, etc. And this go directly to the Ministry of Health, but go also to the district, so the mayor can take action. Those community health workers report to a health center. We have 500 health centers, 1 health center for 15,000 inhabitants. And those health centers report to a district hospital who report to the mayor. And the mayor report to the ministry. But you can see that because it's ICT-based, we can give a timely response. There is 5 people who have a diarrhea or there. The national lab sends somebody because we are in a region where we can have a risk of cholera. So that means if it happens at 6 o'clock at night, before 6 o'clock in the morning, the sample have to be in the lab. And what we teach in the university is how to do that. It's not complicated. Make systems talk to each other. Connect and make the local government and the central government talking to each other, but also talking to the borders. Because we have so many borders, what happened there concerns us also. So if we want to protect the population, we also need to contribute to protect the surrounding population of Rwanda. So all this is interconnected. And that's why I talk about interoperability, because you cannot have 13 systems because you have 13 software. You have to have one dialogue. And all the systems helping you in that conversation that help you to understand your setting, where you are working, with who you are working, and dialogue like this, dialogue like that across sector and across countries.
So we're running out of time. Just the last word to this brilliant audience of Techonomy, where you have business, health, technology all together. What would be your last message?
My last message is whatever you do, do it with cultural sensitivity. Don't bring something and tell people buy it, because they are going to be paralyzed with it. Go to the people and say, what is your problem? How can I help you? And adapt your system to their system. And also, please, they don't know what interoperable means. Think for that for them. They will love you.